It's now my pleasure to introduce to you your first speaker, and she is the first and world-class speaker. Dr. Louisa Williams is the author of Radical Medicine and a champion of biological dentistry. As a non-dentist, she is both a chiropractic physician and a naturopathic doctor. She is also a brilliant innovator. Various techniques such as energetic testing that you're going to see right now. And I had the good fortune of having had a sneak preview from a couple of years back, and you're in for a treat. Dr. Louisa Williams, let's give her a hand.
Okay, this feels a little like headgear or something, which I never had. I just had a bad retainer that I wore too long. So anyway, thank you so much. I appreciate Don Ewing and the IABDM board asking me to come. This group is my favorite dental group, and one of the prime reasons is that ever since Ed Arana started the American Academy of Biology, AABD, back when, we're still following his directions and original concepts of being a group that's very open and honest and curious and even, I want to say, courageous for always being open to new concepts, methodology that's not conventional, like energetic testing, and is not in the typical scientific mode that we have in America today that's talked about. And I'm also going to be talking about, during my lecture, about that word science and scientific, and talking about how that word is much used and abused nowadays. So first of all, I'm going to do my presentation, and then we're going to do a little workshop to practice on each other, and to just see if any of us have any lurking dental foci hanging around, and we can diagnose and identify and treat them. All right. So the name of my lecture is Energetic Testing, In Vivo Biofeedback for More Accurate Diagnoses and More Effective Treatment Protocols. So what is energetic testing? And I call it in vivo because I think that's one of the beauties of energetically testing a patient right on the table. It's right in present time. You're not drawing blood and seeing what the lab work looks like later. You're finding out through various body signals what's going on with the patient at that moment. So besides your very thorough history that you learned to take in school, your very complete exam, lab tests, x-rays, imaging studies, a lot of us have added on energetic testing to just fine-tune our understanding of what's going on with the patient. How many do energetic testing in their practice, some form? Okay. Good, about a third or so. So we got a lot of new people, and that's good, or people that would maybe be interested in this. So energetic testing examples, kinesiology, classic applied kinesiology, George Goodhart, 1964, clinical kinesiology, the late great Dr. Alan Beardall, ART, Dr. Dietrich Klinghart's work, B. Dort, Omura's work, the O-ring testing. Those are all forms of muscle testing, checking the strength and integrity of the muscles and tendons. Then we have electroacupuncture, the great Vol, Vega, Computron, etc. Then we have measurement methods. MRT is my technique. It's an arm length measurement that's based on the signal of the connective tissue and the fascial constriction and restriction because of various problems in the body. We have FCT. Some of y'all were here a few years ago when Dr. Savely Yurkovsky, remember him? He did that leg length testing. That comes out of chiropractic tradition where we had SOT, Deerfield Thompson, anyway, DNFT, chiropractors. We have all these different ways of determining where the subluxation is in the spine. My technique is more arm length test, which is more kind of from an osteopathic tradition. So I'm going to be talking about that today, that these new ideas, these new methods didn't just spring up out of nothing. They came from a need to, again, fine-tune and find out more what's going on with patients. So I like to call it body biofeedback enhanced physical exam. I remember when I went to school originally, or in the early 80s, I don't know if some of y'all will remember this, but we were told that when a patient had more than 3 chief complaints, that they were malingering, to not trust them. You know, it should be like 1 or 2 or 3 chief complaints. Well, nowadays, we have so many patients injured from, you know, vaccines, antibiotics, sugar, GMOs, you name it, in childhood, that the mode nowadays is the common amount is like 5 to 10 chief complaints: migraines, headaches, low back pain, you know, anxiety, depression, you name it. So, but often these patients would just feel horrible and just want to lay on the couch all day. Their blood tests can be normal or close to normal. X-rays can be, you know, within normal limits, etc. So we have a lot of patients just not feeling good from modern, you know, the modern culture and modern toxins. So that's why we need to go a little deeper at times and try to figure out what's wrong with this patient. So let's take, for example, a therapy localization. Therapy localization is a cornerstone of kinesiology. It's when you take a strong muscle and you challenge, you know, the stomach on a patient, and you ischemically squeeze, and you see if that patient can hold the integrity of that strong muscle or they go weak. Now, that came out of classical conventional medicine. For the physical exam, we do muscle grading from 0 to 5. 0 is absolutely no contraction. You ask the patient to push against you, and they can't even contract a muscle. It's a severe case. Or you ask them to push against you, and they can. 3 or 5, they have very strong tonic contraction. So that's taken a number 5 level in the physical exam, strong muscle, and then adding something new, and that was challenging various areas on the body and seeing if that muscle stayed in integrity. And the therapy localization is also based on Sir Henry Head. You know, on the turn of the century, turn of the 20th century was an amazing time. It's probably my favorite time in civilization. There was just so much going on before, sadly, mercury amalgam fillings and pesticides and insecticides and herbicides and GMOs and antibiotics not being truly the miracle drug and everything else that happened in this 20th century. But in the turn of the century, there was just an amazing time of just brilliance. And Sir Henry Head was like that. He would stimulate organs during surgery and determine which skin areas were affected by that stimulation. He was a very passionate neurologist in England. He even worked on himself and surgerized himself. He mapped out all kind of nociceptive pain areas in his arm through surgery. He even worked on his own penis. So you know a guy is really committed to do that. Now, sadly, he died of Parkinson's. And what's our first thought with that? Look at his teeth, you know, who knows. But anyway, so Sir Henry Head, and in Europe we call them head zones, or in America we call them referred pain areas. So these are areas of the body reflexively affected by organ dysfunction. And this is what we all got in school. Then we also have Dr. Irvin Core, who was the very beloved by the osteopathic profession. And he was a physiologist, and he used an ohm meter, just a galvanic skin response meter, to determine high sympathetic activity in the skin over a dysfunctioning organ. Same thing. And he wrote up tons of research articles. He had the famous case where he found chronic sympathetic nerve hyperactivity and dysregulation over a sample patient for a few weeks over the chest, down the left arm, and guess what? That patient 3 weeks later had a heart attack. So he was an amazing researcher. And in our own way, that's what we're trying to do with the therapy localization. We're disturbing the skin, already disturbed, over a disturbed organ, and then we're checking to see if a muscle can remain strong. Or for a dental focal infection, if I ischemically squeeze the gum and the root of a tooth, if a healthy tooth should be able to handle a little squeeze, an unhealthy tooth, a failed root canal or an abscess tooth or an incorrect crown or whatever is going on will not be able to handle that and fail. So, in addition to our physical exam, Kalar, Dolar, Rubor, all the things we look for, we like to add therapy localization to help us further figure out, what should we do for this patient, and also what should we do first and second. The body displays what's disturbing it on the surface first, so it's kind of like peeling the onion, right? Figuring out what's going on now, what should we work on now, what should we work on later. Also, the physical exam we learned in school, there's a lot of these tests that, the Murphy's kidney punch is a little sadistic if somebody has kidney pain. Trendelenburg's sign, this is normal. And then if they have particular hip problems, they should go down on the left. Well, a lot of these things you learned in school, they actually don't show up on all these functional patients. They're kind of extreme for more hospitalized, very ill patients. Like, for example, Romberg's test. Romberg's test, it's interesting. Dietrich and I, Raphael Van Asch in Austria, and Wally Schmidt, the great applied kinesiologist, we all independently have modified that. And the reason we modified that is because most of our patients don't come in having a posterior column disease and falling over when we do this test, but they do have other symptoms like falling to the side of the focal infection or falling because not being able to stand up when the legs are together and the fingers are pointed like this and the eyes are closed. Because of a chronic major food allergy, which affects your C1 vertebrae all the time and makes you unstable. So a lot of us just independently and through the years, which I'm sure a lot of you have too, we've changed some of these more extreme, disease-oriented exam findings, more for the patient that typically comes in and sees us, especially with to be preventive so the patient doesn't get into a disease situation. Like, here's another one, the physical exam not being specific enough. So this is the orthostatic hypotension test. And this is well known. I had some patients hiking in Switzerland, and this is one of the tests that was positive when they went to the emergency room at the Swiss hospital. So it's good to hear that some of these hospitals in Europe are still doing the basic testing. But the positive test for this classically is a drop of 20 millimeters of mercury systolically. Now that's a hell of a drop. So you take the blood pressure of the patient sitting or lying, and then you have them stand up. And when they stand up, the sympathetic nerves should squeeze those blood vessels so you don't get dizzy, right? Which can happen sometimes when you're exhausted and have adrenal exhaustion. So you don't get dizzy and the blood pressure rises. Well, in applied kinesiology, they modified this years ago to a drop of 4 to 10 millimeters of mercury indicates either adrenal exhaustion, heart problems, toxic mercury amalgams, who knows what the problem is. But again, a lot of these classic disease-oriented tests have been modified by holistic physicians and practitioners for years. So, we do our history, our comprehensive history. Who knows what the word anamnesis means? Greek word meaning complete history. It's a homeopathic word too, meaning your history is so good, and that's what they always say, right? The masters, they always say, go back to the history. It's all in the history. Your history is so complete and thorough that by the time the patient finishes explaining it, it's almost completely clear what's wrong with that patient. So it's a really good anamnesis, a complete history, a very thorough physical exam after that information, needed lab testing, appropriate imaging, and then for some of us, we've added energetic testing. We don't forget all of those things we learned in all those grueling years in school. We're just adding. We're being inclusive. There's John Trowbridge. I don't see Bob Battle, though. There's Dr. Battle. So I just want to give kudos to Bob and John and Don Ewing and everyone who has this chart, who's not a dentist, has this chart on their history and exam. We check these things. We don't just do a cursory look at the teeth while we're looking at the tonsils. And I'll tell you, even in naturopathic medical school, this was not covered to really look at the teeth and diagnose, especially at the level we do. Because we know that 50 to 80% of the problems can be in the mouth, and sadly, we're in the minority. Not many people really check out the teeth. And in a way, to not be saying something too strongly, but I have plenty of patients that are referred to me from other doctors, and I just, I look in the mouth and it's like, easy. Mercury amalgam fillings, gold crowns, dental galvanism, chipped teeth, you name it. Wisdom teeth impaction, all kinds of things. So this is very important in our history and exam to make important dental clinical decisions and not to engage, again, I don't want to say this too strongly, in a little bit of malpractice of continuing to treat that patient when there's a bomb in their mouth, when they've got ridiculous dental problems in their mouth. So I'm preaching to the choir, but I appreciate the doctors and practitioners here that are always checking this and doing due diligence on a very common problem. So energetic testing in biological dentistry, you can check which supplements are most effective for your mercury amalgam detoxification if you do use supplements in your practice. I have so many patients that come to me that, I had a crown placed 3 months ago, 6 months ago. It's never been okay, and there are just so many things you can do for that in regard to lasering and using some of these drops we're going to be talking about at the time to reduce the inflammation so that you don't, for $11 wholesale, using these drops and sending the patient home with that, instead it will save you thousands of dollars in redoing a crown. And of course we use good crown material, but some people don't. Interference, sometimes just a little equilibration on that crown is needed, as y'all all know, or needed homeopathic or isopathic support. I'm one of those ones that believes in arnica just before dental drilling or just before surgery. There's a big controversy in homeopathy on that. In fact, Michael, who's now deceased, but the guy that started Hahnemann in San Rafael in California, that's the best homeopathic company in America. That's the number one. He was one of the ones that said, don't give arnica before surgery, don't give arnica before dental drilling. But I looked at the research that he was citing, and it was just not well done at all. I have found the opposite. 5 minutes to 30 minutes before surgery, a little arnica can just make a major difference in reducing the inflammation during drilling. I like 200C. Thank you, Joan. I like arnica 200C. Not too strong, not too weak, just right. Yeah. Oh, yeah. Okay. Okay. Blanche is saying go to 1M. Now, I do surround the dragon after surgery. I surround the dragon, Blanche, with also like Hypericum 200C for the nurse and alternate. Yeah, so Blanche is saying hit the 1M afterwards, which is probably appropriate because you need to balance the strength of the surgery with the strength of the potency. And then also we just have chronic intermittent tooth and gum inflammation for no discernible cause, x-rays negative, CT scans negative. What do? Sometimes we like to use energetic testing to try to figure out what the problem is. Is there an odontosomatic problem? Is there an impacted wisdom tooth or an incorrectly pulled wisdom tooth where the bacteria that's chronically being generated from this subtle focal infection metastasizes through lymph, blood, and axonally is transported along nerve pathways to the heart and the gut and other places. Is it that? Is that the problem with the patient? Is it odontosomatic from a galvanic current? I love these. This is easy. You don't lose a tooth. You just pop off. Listen to me, I'm not a dentist. And just pop off. It's easy, but that's what I tell the patient. Just go have them pop off that gold crown, and often they'll find either bacterial infection, black, or mercury amalgam filling underneath, or whatever. And also, we have to educate patients about PFMs, right? We all know what PFMs are, but most of our patients don't know about porcelain fused to metal, and often that metal is stainless steel. And what did they put in stainless steel after World War II? Nickel. Nickel is allergic officially to 20% of women. 20% of women have a nickel allergy, 10% of men do. I think it's a lot more than that. And you know what I think y'all should all put on your dental exam or history form, intake form, for women? If you wore cheap jewelry as a child, did you get black or stain on your ear or on your ring? And if they say yes, there you go. They have a significant nickel allergy. They have no business with PFMs in their mouth. And of course, we also have learned a lot from the neural therapist and the German history of understanding about focal infections. And we don't give NSAIDs and all kinds of medications and stuff like that for if a patient comes in with right shoulder pain or right hip pain. We look first to the mouth and see if it's something obvious there. But is it a somato-odonton relationship? And I want to challenge all of y'all to think about this more. If the x-rays are negative, if you cannot really figure out what's going wrong with that gum area or that tooth or whatever, consider a somato-odonton relationship. I had number 32 surgerized 3 times. And it was just because I had such a bad gut from antibiotics and sugar as a child. So that chronic dysbiosis was reflexing in there. Last time my surgeon treated it, he said, well, there really wasn't anything wrong, but maybe it was just the architecture. The contours needed cleaning up, his little sharp contour. But I probably didn't need the surgery. So I just had to get straighter and straighter about my diet and get healthier and healthier. And dysbiosis of the gut from childhood is not easy to heal. We're all trying to eat better now, but it's a bear, as Dr. Trowbridge specializes in. So you can have, for example, a pancreas or stomach chronic inflammation affecting a tooth. And there's nothing better than threatening a root canal or a holistic root canal or whatever. I know a lot of y'all don't believe in that. But anyway, threatening pulling a tooth or whatever to a patient to get straight about their diet. And one thing is sugar. Just have them avoid sugar for 2 or 3 weeks. The other thing is a food allergy. Food allergies are huge. They're major. And we know the top 2 are gluten and dairy. And then there's eggs and corn. But if you go to my website, austonnaturopathicmedicine.com, didn't put that in here. AustinNaturopathicMedicine.com, and you'll see naturopathic tips. The very first tip is the elimination challenge, the food allergy elimination challenge. And that's you avoid a suspected food allergy, dairy or gluten or eggs or whatever, for 2 weeks. You see if you feel better. You see if that chronic pain in that molar or that little irritation goes away, and then you eat it one day and you challenge it. And that elimination elimination challenge test costs nothing, and it's the gold standard, and it's more effective than the $400 blood test. So that's a good place to send these patients when you just can't figure out why they continue to have gum problems or irritation, these more subtle subclinical problems. So we want to practice radical dentistry, right? This is my book, Radical Medicine. We don't want to just give Motrin for that shoulder pain. We want to diagnose to see if it's a dental focus. We don't want to just prescribe antibiotics for that chronic sinusitis, right? We want to see if it's a failed or infected maxillary root canal or apicoectomy or something like that. We want to practice radical medicine in dentistry, and we do. So my method, which is this arm-length connective tissue method, can be employed with local and general anesthesia. That's a good thing. The connective tissue doesn't go to sleep or get sedated, and so you're able to still tell if there's a constriction or disturbance in the body. Dr. Russ Bornman isn't here, is he? I don't think so. Russ has used my technique during his cavitation surgery for years now. Of course, he's also using his many years, as y'all do, of skill and almost psychic ability, right? Because you've done it so many times. In Greek language, they call that gnosis, right? Gnosis, just that knowing when, you're finished. One doctor told me, the patient's eyes light up when you're all clear. You can feel it, but also you can help aid that by cleaning out and drilling out all the necrotic material and then just making sure you're absolutely finished with the arm length test. Dr. Felix was talking about, Dr. Liao was talking about that he also can use this with his DNA appliances. Same thing. You're having a patient, you're trying to equilibrate the dental appliance just right, just perfectly. You already know it, you can already tell, but just to help, you have them clench and you make sure that appliance is exactly fitted right and they're ready to go home and start opening up that bite. I use it a lot too for determining a malocclusion, which is a big decision because I know I'm going to have to send that patient to an orthopedic dentist for a year or two or so. And so I really want to determine, does that patient have a major malocclusion? Is this worth the time and the money? Well, it's a tricky decision because how many of us have a perfect bite nowadays? Not many, with all the fillings and the incorrect extracted teeth and not having bone broth as children and not being breastfed and not having the expansion and all that. So almost every patient comes in with a malocclusion. I'd say 80% or so. And from there, though, when I get them on the constitutional remedy and do all these other things, then I have to decide whether that malocclusion is so significant that they need to do DNA or other expansion orthopedic appliances. And if they do, it's enormous, and that's the stone in their shoe they have to remove and have to clear before they can get better because they have no grounding, right? They have no support without a good bite. All right, so now the scientific word. Is energetic testing scientific? That's the number one criticism, and I wanted to address it because you hear it all the time. It's quite unconventional. Most people walking down the sidewalk have no idea what you're talking about, right? So has kinesiology, Vega, Vol been published in peer-reviewed scientific journals? Hell no. No way. They wouldn't. Big Pharma censors us zealously. So let's talk about scientific, though, for a moment. When we're talking about the gold standard of scientific journals, Lancet, New England Journal of Medicine, JAMA, et cetera, these are they. And but in recent years, we've had more information coming out about these journals. So who's heard of Marcia Angel? Yeah. Brilliant woman. She's in her 70s now. She's currently a lecturer at Harvard Medical School. She was the first female to serve as editor of the New England Journal of Medicine. And this is an incredible statement by Dr. Angel. Am I pronouncing that right, Angel? Angel, I think. This is her book, The Truth About the Drug Companies, because she got fed up with it. It is simply no longer possible to believe much of the clinical research that is published or to rely on the judgment of trusted physicians or authoritative medical guidelines. I take no pleasure in this conclusion, which I reached slowly and reluctantly over my 2 decades as an editor of the New England Journal of Medicine. So this is an excellent book. I know I'm preaching to the choir here. We all know about drug companies and how capitalism at any cost is destroying our country. Polypharmacy is the rule now. Here's the most respected journal in the world, perhaps. Yeah. I love that. Felix just said that she said there's no such thing as complementary and alternative medicine, because I'm one of those people that get the hair on my back standing up when I hear that. It's kind of like saying, oh, you're okay, and your little golden seal and your little echinacea, removing the mercury amalgam fillings, they're okay, but it's not real medicine. Love her. Love her. Thank you, Felix. I'm going to include that in my information. So here is Richard Horton. He is still the editor-in-chief of the Lancet. Much of the scientific literature, perhaps half, may simply be untrue. I have this in the appendix of my book. More than half of all allopathic treatments, drugs, surgery, etc., are never scientifically validated. A study was done and published in the Lancet, and 50 to 85% of these research studies were not based on peer-reviewed controlled research. So we don't hear that on the 6 o'clock news, but it's the sad truth. So it's good for us. We know this, but it's good for us to remember this. So what's the definition of scientific? A system of knowledge based on general laws obtained and tested by the scientific method. The scientific method requires the use of certain principles and procedures for the pursuit of knowledge. Open, honest, curious, through observation and experiment and the formulation and testing of hypotheses, like Koch's postulates, right? Koch from Germany, the famous doctor who said that there were 4 criteria to establish a causative relationship between a microbe and a disease. And until you satisfied all 4 of those particular criteria, then you could not say that disease was caused by that bug, that virus, parasite, etc. But we have so much of that information ignored nowadays through the media. For example, wonderful Dr. Stephanie Seneff, everybody knows her. She's the expert on the #1 herbicide in the world, which is Roundup. Glyphosate is the active ingredient in Roundup, and it's destroying our earth. It is so scary. In 2012, she lectures at the Weston A. Price Conference every year, which will be in November. Love her to death. She's amazing. Anyway, in 2012, Brazil passed the U.S. as the larger buyer of pesticides in the world. In northeast Brazil, where the Olympics were, this is so ridiculous that I want to laugh because I'm going to cry. They put pesticides in the drinking water. It's so toxic there that they have put pesticides. It's ridiculous, in the drinking water. So she talks about the onset of the excessive amount of pesticides, including Roundup, glyphosate in that area where the Zika virus was spread from, and the fact that pregnant women started getting flu and DTaP exactly 1 year before this Zika virus broke out and this microcephaly happened in the infants. And the whole thing about this mass hysteria and Zika virus, and that this mosquito's been around for ages. It's not the mosquito. It's this destroying our immune system and hurting pregnant women and hurting the fetus. It's sad. But again, you won't hear that on the news. Let's talk about psychiatric medications. Are they scientifically proven? There's a great psychiatrist, Dr. David Healy, who has been beating the drums about this for a long time. Some 90% of school shootings over more than a decade have been linked to a widely prescribed type of antidepressant, SSRIs, Prozac, etc., that have the side effect, especially in children, of suicidal ideations. Exactly what they're, not supposed to do. So, allopathic medicine is no longer the gold standard, but sadly, that is not being propagated. The U.S. Congress in 1978 also researched this, and they found in their research that only 10 to 20% of all the procedures in a medical practice, prescription of pharmaceuticals, surgeries, procedures, etc., have been shown to be efficacious by a controlled trial. Unbelievable. Okay, so now let's ask the question, is energetic testing research? Do we have research on energetic testing? Well, in holistic medicine, we know that especially in Europe and other parts of the world, and some in America, but mostly in other parts of the world, we have thousands and thousands of research studies attesting to the efficacy of herbs, botanical medicine, homeopathy, supplements, vitamin supplements, etc. There's just thousands of research articles, and this is also in the appendix where I have talked about that. But what about energetic testing, kinesiology, arm length, leg length, etc.? We have some, but we have obstacles. And I'm just putting this in because don't blame the victim, right? NIH never has knocked on our door and said, I'd like to give y'all $100,000, $10,000 to do a study on this. That doesn't happen, right? That doesn't happen. No medical school, Harvard Medical School, never called up Dr. George Goodhart and said, this kinesiology is very interesting. I've seen you've gotten some good results. Would you like to have a chair, a professorship at our school? I'm kidding. And that's what's so sad. Some people say he should have gotten the Nobel Prize. We hardly have any insurance coverage, and there's no media coverage. That's the big thing. People don't even know about energetic testing, except for our wonderful patients that find us. So who watched the 6 o'clock news with David Muir on ABC or Lester Holt on NBC and saw that I cured a patient with rheumatoid arthritis and irritable bowel syndrome? Did y'all see that on the news this summer? No. But I was published in the Wise Traditions, the Weston A. Price Journal. And this patient was on medication. She was about to get a TB test so they could put her on even stronger medication, which caused TB in patients. So anyway, this is my feature where I talk about the 5 obstacles to cure. Please join the Weston A. Price Foundation. It's only $40 a year. We can afford that. Yeah, please join the Weston A. Price Foundation. And you get a journal every quarter. You can put it in your reception room. So my 5 obstacles to cure, what's the first thing I include? Toxic metals, and then, whoops. I thought I had focal infections, and I had focal infections in there. Anyway, focal infections are in there too, dental focal infections. Anyway, so it's really hard to talk to the general public when they just hear that vaccines don't cause autism, or the free advertising on the 6 o'clock news, right? A new drug to cure this form of cancer. You know, it's like, oh my God, unbelievable free advertising. So, but let's go back to the subject of, do we have research on energetic testing? Well, ICAC, the International College of Applied Kinesiology, George Goodhart's group, he's passed on now, but it's continuing, has been doing tons of research for many, many years, published in the JMPT, the Journal of Manipulative and Physiological Therapeutics. Now, a lot of this type of research does not involve pharmaceuticals. So therefore, it's a little, the JMPT is a pretty good journal because it's based on structural therapy. So there's not, you don't have that influence from big pharma manipulating the science. Here's electro-EMG effects of fatigue and how that affects strong and weak muscles. Lots of research through ICAC. Dr. O'Meara, I don't think he ever sleeps, does he? He is amazing, and he comes out with this fantastic controlled double-blind research all the time. So Dr. O'Meara has done a lot of research testing with his O-ring test, and that's in the literature. In fact, if you can't beat him, you open your own journal. So that's what he's done. He started his own journal. And acupuncture of electrotherapeutics research, because there wasn't one around. So he's originated that and published lots of information. Here's on our IABDM website, 40 years of electroacupuncture according to Voll, Dr. Voll, which Dr. Don Ewing teaches and a lot of y'all know. And it's all the excellent research done in Germany from Dr. Voll. Now here's Vega testing by Dr. Schimmel. He told me to get my tonsils out many, many years ago, and I didn't. I kept battling on. Maybe I should have, but no, I'm very, very healthy now, thank heavens. So anyway, so these are important decisions. Remove a tooth, remove a tonsil, etc. So Dr. Schimmel, now the reason I put this in here, you'll see a lot of this quack devices, Vega machine quack devices. I included this because we know better, but still, it's hard to not be overwhelmed and burdened with all this persuasive negative literature on the internet. Stephen Barrett, the quack watcher, not a friend of ours, etc. Who watches Homeland? Who watches Homeland? Yeah, it's a great show. Who watches Homeland? What's wrong with y'all? Y'all don't watch it. It's a great show. Anyway, if you watch Homeland, or if you're smart about computers like Dave Warwick here, you know what sock puppets are. You know what sock puppets are? Sock puppets are paid bloggers to influence public opinion on the internet. And they're very insidious, like I've heard some negative reporting on Celebrex, but it keeps my arthritic pain down, and I've used it for years. Things like that. And then it's signed like firefighter or teacher, third grade English teacher, something like that. So, I mean, salt of the earth people. These aren't real people. These are paid bloggers that big ag, big pharma, big corporations hire to influence the public. We saw that last year a lot with what? Politics, both sides. A lot of influence. And what does that remind you of? 1984, right? I mean, it's scary. And there's been a lot of information on the internet about that. But we want to remember that this is a shame. There's not one positive thing, fooling patients with a computerized system. And we know where that's coming from. But it's, debilitating after a long day, right? It's tiring. Okay, I'll buy somebody a drink tonight if they know who this guy is. Who's as old as I am? No. No. I'm not buying anybody a drink. Nobody remembers this. My sister and I were really fixated on this TV show. This was The Millionaire in the 50s, and maybe mainly the 50s. And this is Michael Anthony surprising a woman on the doorstep and telling her, "You won $1 million," which was a lot of money in the 1950s. I mean, it still is, but back then it was amazing. And then the trick was the woman or the person couldn't tell anybody where she got the money. That was the trick. Or John Beresford Tipton, the multimillionaire who handed out all this money to people, would take it back. Sadly, my sister and I got really fixated on that, and I think I've been waiting for Michael Anthony to knock on my door all these years. You know, it's like waiting for the lottery. You know, oh, I know this magical thinking will pan out someday. But again, it's that same idea. Until the NIH knocks on our door, etc., I don't have any published research yet. I'm going to start teaching again in January, and you know, I hope to be an ICAC someday. And maybe some of y'all would like to be teachers and teach my information, but until that time, I don't have published research. I'm just trying to keep my practice going. Okay, so in my appendix of my book, I also talk about energetic testing. So it's a little synopsis of what it is. I love this quote by Arthur C. Clarke: "Any sufficiently advanced technology is indistinguishable from magic." All right. Goodness, we're doing great on time. All right, so we're going to demo and practice with each other. And for those of you that don't do energetic testing, I just want you to experience perhaps the feel of how the body changes when you challenge it with a good thing or a bad thing, and how that feels with an arm length test or with kinesiology or whatever you want to practice. So my technique is not muscle testing, it's matrix reflex testing, and it's challenging the connective tissue. The connective tissue is made up of the solid fascia. Remember the shrink wrap package, the dura, the arachnoid, the pia mater, and all the fascia throughout the body surrounds all the tissues and organs, as well as the extracellular fluid, that watery ocean inside of us that goes from gel to sol depending on stress, and therefore can be measured using certain signals. Dr. Oshman has done fabulous research on this fascial matrix web. Again, like the nervous system, if you took away all the other tissues, the body would be quite recognizable through the fascia and matrix tissue, that is completely interwoven with all the body cells and tissues. Dr. May Wan Ho in England, great artist, great scientist. I think she just died. So sad. I really wanted to meet her. Brilliant researcher. She has found that the information in the body that is carried through the matrix tissue is faster than the nervous system. Faster. Unbelievable. Hard to even imagine. And this fascial constriction is what we attempt to measure, and we keep refining our technique by this reflex arm length test, which is the heart of my testing. So Leonardo da Vinci in the 1400s did this famous canon of proportion picture chart expressing the fact that health is proportion, symmetry, balance, and the opposite of that is distortion patterns. Your chiropractor says, oh, you always have a short leg, you know, or you always have this particular pattern. Well, over time, Scars, amalgams, sugar, GMOs, medications, divorce, injuries, horrible things that happen to us in life, unless we have the ability to come back with that, and unless we have the courage to do holistic medicine and dentistry and continue to fix our bodies and regenerate, we go into these chronic distortion patterns. Dural torque patterns, the craniopaths call it. So the reflex arm length test can measure this stress response. Obviously, when somebody takes my arms and pulls them cephalad and stops when they feel that rubbery stopping point that is my fascia constricting evenly on both sides, I should be even, right? Should be even legs if I'm in good health. So we're going to focus on the teeth. So I want all of y'all to be thinking about a wisdom tooth extraction or a crown you had placed or any place where you have like a little irritation or it's not quite right, even if you've had it treated. And then we will use you as a patient. All right. So Dawn, I'm sorry, I probably didn't put enough. I only made 30 handouts, but y'all can share. So, okay. So Dawn and Dory are handing out some information, and I'm going to demonstrate. Going to have some tongue depressors, gloves. We'll just put the gloves on one side or the other, some handouts. These are some drops I use. I think you should all use them in medicines. Mike Sheehan's BioResource San Pharma drops. They're like the Sonum drops, but I find them a little better, especially for home use. Okay. So, who wants to be a guinea pig? Okay. So, first thing, we're all going to do this in a minute, divide up into 2s and 3s. We want to take off our cell phones, keys, hotel cards, anything like that. You're okay? Okay. Corrine? Yeah. Louisa, nice to meet you. Yeah. Just have a seat. Yeah, great. Okay. Even the key card has got a magnetic strip, credit cards, all of that. What'd you take off, dear? Okay, but these are okay. Yeah. Just regular metal is okay. So you want to remove all your EMF stressors first, if you're the patient. Oh, watches are a very good question. I used to think that we all had to have a Rolex because it's a natural movement, but even the Rolex causes a little stress. See, my technique is so sensitive that we can't even have Rolexes anymore. So, and you can do the wind up, but those don't keep very good time. So definitely take off the watches. Yeah. Those are a stress. They're not perfectly compatible with the body's very precious, very sensitive energy. Okay, so the next thing we do is we test the reflex arm length. And I like to do this in a chair. Years ago, I was speaking in front of the HDA, and it was the first time I showed this to a dental group 10 years ago or something, and I noticed all these HDA dentists were really getting it so fast. I thought, wow, they're getting this faster than my, naturopathic, medical, whatever students. And then I realized that normally when we're in a conference, we're laying down, and that's usually the way we test a patient, but that when you're in a chair and you're testing the weight of a patient's arms, it's really obvious to feel if, one side's heavier than the other and you have a pattern, okay? So anyway, that's why I'm doing this testing in a chair. And why don't you keep, Corinne, keep your hands up like that. Okay, so what you do on a patient, you don't grab the acupuncture points, pulse points too much. You don't get all into the hand chakra primary areas. You just kind of grab the outside of the hand. You have the patient relax, which is hard, and then you just without caring. You just pull up, 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 up. Here we go. Here's the rubbery stop. I can't go any further without cheating. And then I bring her hands together. Corinne, can you make your hands go up? And what is she? Right short. See that? See those thumbs? And then we relax. And then you do it again, because they could have a mixed pattern. So again, patient is trying to be a patient. Doing good. It's hard for us to be patients, isn't it? You're doing great. So I do it again. I pull, pull, pull. I feel that rubbery stop. Can't go any further. And then we look at the arm length. And what is she? She's right short again. Okay? So you can do that 2 or 3 times, and you diagnose your patient right short arm. Why? Could be anything. Yeah, right. I mean, yeah, patients. In fact, when Dietrich and I learned this from the beginning, before I changed it some, from Raphael van Ascht in Austria, he's a brilliant osteopath, and we started out saying that the right arm short was related to a right dental focus, because it happens so much, so commonly, or structural problems. But actually, you could be right arm short because of anything in the world. Why? Because what you're seeing is the external signal from years of this, that, stress patterns, okay? So again, unpeeling the onion. All right, so Corinne is right arm short. And we test several times. The reason we test several times is that you can have a presentation where the patient's right arm short, patient's left arm short, patient's even, where even is good, or they could be right, left, or they could be oscillating. And oscillating is another pattern that can only be diagnosed through MRT and auriculomedicine. So you're not able to really figure this out in other techniques, but it's a mixed pattern. And oscillating is when we test the patient, thanks, and we test her. I'll just mock this up. And she's right arm short. We test her again. She's even. Test her again. Right arm short. Test her again. And she's even. Okay, and that's what I call oscillation level 1, a common presentation. So you guys may see that presentation too. But just remember the big things. It's important. It's good to be even. Not important. It's health to be even. And anything short or on right or left side or oscillating is a problem. So we're going to treat her. Thanks for having a problem here. Third thing is we diagnose. I have some, thanks. Yeah, tongue depressors, handing out gloves. Do you have any chronic little dental issue or big dental issue?
Yeah, this one tooth has been sensitive lately, and I think I have a root canal on this one tooth now.
Okay, all right. So she has a root canal on, is it number 30, 31?
I think it's the 6-year molder. I'm from Canada.
Oh, that's number 30. Yeah. Okay. All right. So we'll take a look. Oh, look. Oh, you have your wisdom teeth. Aha. They're back there.
I wanted to take them out. It wouldn't let me.
Interesting. So this is always an issue. I cite the Germans when they have their wisdom teeth, and y'all tell me if I'm wrong here, but I say in Europe it's healthy and you have a proper appropriate bite when you can put your little finger past your wisdom tooth in the retromolar space versus jammed in the back, right? Well, you hardly find anybody that can do that, and yours looks pretty jammed. So anyway, then you have to make a decision about that. Also, Corinne has got a gold onlay on her number 30. So, and did a conventional dentist do that? Conventional dentist did that. So the conventional dentist might have left mercury in, or the gold could be a problem too, because what did Vera Steshkal find in her Swedish research through the Louisa test? That gold was second in allergenicity. So it could be any of these things. So normally, you know what, Joan, would you put on a glove? We don't have to go through to oh, here's some gloves. Okay, come over here, sweet. So what you can do is you can have your assistant stand over here, and you can, so first of all, what I like to do is I'd like to take number 32 and just push it down a little more. Just therapy localized 32 and impact it, well, it's not impacted, it's erupted, but stress it a little more. Okay? So Joan's got that, and then I recheck. So limp, 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 limp. And so this is diagnosis. And look, she's right arm short. We do it again. She remains right arm sharp. So that's like a therapy localization, and the body's saying, that's not my main problem right now. Now, dear, can you just get number 30? It's a gold crown, a gold onlay, I think. Okay, we'll ask about the gold onlay. This would be nice, because just pop off that onlay and put on some compatible materials. Here we go. Very limp. We check again, and look. Looks like she's even. We do it again just to make sure we didn't induce some kind of oscillation. We pull up, and she's even, okay? So now, yeah, thanks, Joan. Yeah. She just grabbed it. She just therapy localized it. Oh, well, come back, dear. Either way. Yeah. Joan was therapy localizing the crown, but it's hard to tell because the whole tooth is in stress. But anyway, dear, so go ahead and therapy localize. No, I thought she was dead even, but let's do it again. Here we go. Limp. Joan's got number 30. We're therapy localizing number 30. Number 6 in Canada. Okay, I can't go any further. I put the arms together. She's even. The thumb. Oh, look at the thumb. The thumb. I'm sorry. Yeah. Look at the thumb. The thumbs are even. Take your hands off, Joan. Okay. Well, the fingers, yeah, it kind of, you know. Yeah, and it can be kind of hard to tell because she could have different distortions, but you've got to either do the wrist creases or the thumb specifically. Okay, so now let's check. We're not holding number 30 at all. Let's double check. Again, very limp. I go straight up. I can't pull any further. I put the arms together. And in the clear, she's right arm short, right? Okay. Yeah, but good we brought that up. You look at the ends of the thumbs because there are kinds of, musculoskeletal distortions. Wait a minute. Wait.
Let's say that you identify number 30 as your problem. How do you know it's the material?
All right. You have to come to my class in January. Because then, as we do in kinesiology with the therapy localization, you would challenge a gold vial, you'd challenge nickel, you'd challenge mercury, or you'd challenge, if it's a root canal, you'd challenge bacteria, or, there are all kinds of ways. And that's in energetic testing. It can be so confusing, and that's why we all have filters. Vega vials, or hand mudras that I use, or other things that you're able to tell, because it's a very good point. Yeah. Okay. So now, yeah, that's it, Joan, thanks. So now we're going to treat, hold on, Corinne. So you can do your regular diagnosis, figure out which tooth is the problem, and fourth is do treatment. I act like I own this company. I don't make any profit, I wish. This is San Pharma. from Germany, and I have two here, the classics. Notasan, which in Sonam terms is Notakil. This used to be called Notatum, that they changed it to Notasan recently. I love this product. I use it like water. Why? It's anti-inflammatory. It's mildly antimicrobial. But what's the big deal? It doesn't engender an autoimmune backlash. I would say generally, liberally speaking, any of us that have had enough antibiotics, we're autoimmune. We have allergies. We have all kinds of symptoms. So this does not do that because it doesn't kill. It's not an antibiotic. There's times to kill right after surgery, you know, when you use colloidal silver or oregano oil or whatever you use. But in general, chronic bacteria, chronic inflammation, you don't want to kill because what are you going to do? Create more resistant bacteria, more cell wall defective bacteria. So we have the Notasan, or we have the Aspersan. This is the old Aspergillus niger. It's back in America. And this is one of the reasons, too, I hope y'all will consider carrying this in your practice, because if Mike doesn't get enough orders for some of these, then he doesn't order them from Germany, and then I'm in trouble, so because I use them so much. This is the Master Soft Tissue and Joint Therapy. Normalizes the biological terrain, also anti-inflammatory. This one they talk about in the German literature as being for paratuberculous issues, not just for the lungs, tuberculosis, but all the the nearby chronic infection in the body, like urogenital problems or chronic tonsillitis or chronic glomerulonephritis, etc. All these chronic long-term issues that are the death of us someday. So it's a little stronger, but very, very important. And it's for, they even talk about for the inherited TB miasm, which is mycobacteria, which is just proving pleomorphism right there, right? What's mycobacteria? From tuberculosis, a fungus and a bacteria. Happens all the time that these microorganisms change shape, etc. Yeah, and I just wanted to say that I know you guys inject the Sonam, do a great job during surgery, using arnica, doing all these things, but there's a yin and a yang in life, right? And the yang is during surgery when you're injecting, and it helps so much to send the patients home with these for the next 2 or 3 weeks to continue the healing. And because the Notasan is yellow and the Aspersan has a black label, I say Notasan in the morning, a couple of drops on the socket, Aspersan at night, 2 to 3 weeks. And it's amazing. Patient comes home and just heals beautifully after cavitation surgery. Patient gets a crown, and 2 days later or 1 day later says, "What crown?" I can't even tell. You know, the inflammation has gone down so much. All right, so the fifth thing we're going to do, oh, okay, well, we didn't treat. Okay, so the fourth thing we're going to do is treat. Now, you can just choose one, or you can test which one tests for her. Now, she may have a galvanic problem, but that is causing chronic inflammation, so, all right, dear, so we know she's right short arm, my anatomy there. So, this connective tissue is so subtle and so sensitive. We can just put this bottle in her energy field anywhere and then retest. And it's like therapy localizing the supplement. Let's see if she changes with this good supplement or good remedy. Here we go. Now again, remember, have the patient relax their arms. You're going to pull straight up to the ceiling. One of the things that people usually do at first is like that right away. Don't do that. Go parallel lines, okay? When you practice on your patient, straight up. You don't care, you don't care, you don't care. And here we are. I can't pull any further. I look at the ends of the thumbs. And I would call that even. If it's a millimeter or two off, do it again. Double check her again. She's got the Notasan on her. Pull, pull, pull straight up to the ceiling. Now put those thumbs together, and she is even. So she likes the notisan. We can check the aspersan, put that on her energy field. And again, you pull straight up. Pull, pull, pull. I can't go any further. And she remains right arm sharp. See that? See the thumbs? So aspersan isn't her remedy right now. Okay, then you treat the patient. So you all have, every table has sample bottles. These are courtesy of Mike Sheehan. Thank you, Mike. And then keep the tip sterile and just drop it in near the number 30. Doesn't have to be perfect. So open wide and drop a couple of drops in. And you have treated her. And then we retest. Let's see what happens. Now, again, she probably has other problems besides the galvanism or the whatever in her number 30. But remember, these drops are homeopathic to a certain degree. They're dilution, so they're affecting the whole body. So it's a systemic treatment in general for inflammation. Okay, so again, here we go. We pull, we go. Actually, pull's not the right word. We allow the arms to go up, up, up. And then we put the thumbs together, and she's even. Check her twice. And really pay attention to the restrictions, contractions. You're feeling the whole body. You're feeling the fascia contract in the whole body, evenly or unevenly. Now we put the thumbs together, and she's even. Okay, so the treatment was a success. All right, thank you, Corrine. Good job. All right, so we have like 25 or 20 minutes at least to practice. So everybody at the table here, here's your assignment. Get a patient, a doctor, a teacher, get into groups of 2 or 3 or 4, however you want, and ask what I did with Corrine, any dental problems. Check in the clear first. Remember, first you remove any stuff, you test the arm length, you find a focus, you treat, and then you retest. So let's practice. Okay, y'all, 5 more minutes, and then we're going to sit down again. 5 more minutes. Oh.
Okay, you guys, please have a seat. If you are trying to get connected to internet, it's capital W, little w, 12. I've gotten some questions about syllabuses versus jump drives versus the app. You know that we have an app. Please use the app, and you can follow along with the slides. You either signed up for a syllabus or a jump drive. So some of you are following along on a jump drive and others are on paper. I'm out of syllabuses, but if somebody wants a jump drive, we have them. I'm going to have everybody get seated so that Louisa can get back on track here, and then I do have something to do afterwards.
Okay, excellent testing, excellent questions. Of course, you can't teach a technique in 5 minutes, but I was very impressed how everybody was testing so well. I was telling these guys, Heather, that it's interesting that this is the opposite of kinesiology. When you have a man in kinesiology with big, strong muscles, you're always fighting him, right? And it makes it hard to test. Men are easier to test with the arm length test because of that musculature is so clear. But very limber women can be harder to test because they're so limber that you go up, 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 up. You keep going, and it's kind of tricky how far you should go before you put the thumbs together and retest. So thanks. The good news about this method is that within a very short time, it should be really clear and really easy to test. You can tell already the basic kinesthetics. You can feel that whole contraction pattern, especially if somebody is obviously left arm short. You can just begin to start feeling that whole left side contract. That doesn't necessarily mean they have a left dental focus. It could, or it could be contralateral, or it could be years and years of this problem, that problem, this problem, that problem, and, you know, peeling the onion and unwinding those chronic patterns. There's a good question on should the tester worry about his EMFs, or if he's in distortion, if he's short on one side, will he affect the patient? Well, we always had this problem. It's always an issue. My answer for that is if you're reasonably, you know, if you have cleared your issues reasonably well and you're reasonably intact, your energy field isn't so much affecting the patients. But if you've got a major issue that day, yes, it could be getting some false positive testing through the patient. So when we teach seminars, we often say patient has a mouthful of mercury. We'll put some algae in the pocket of the tester to mitigate that so they can be a neutral tester. All right. So, bioresource, please call Mike. Order these. I have the patients take them 3 weeks or so. Notisan in the morning, Aspersan at night, something like that. And I do great with any kind of dental drilling, dental focal infections, etc. And it's part of my protocols. All right, so advertisement, I'm going to start teaching again. I moved to Austin from California 2.5 years ago. So I'm going to be teaching in beautiful Austin, Texas in January again. I have some brochures if you want to learn this method. So thanks again. I appreciate it. It's been a great audience, and thanks for working with me. Thank you.